I would now like to hear from Dr. Robert E. Smith.
Back in World War II, there was a great concern in our government because Nazi U-boats were torpedoing our ships close to the United States. And there was great fear that we might even lose the war. And there was a congressional hearing about it, and someone, I think it might have been Will Rogers, testified that he knew a way that we could solve the problem by boiling the ocean, and then when all the submarines came to the surface, we would just shoot them. Well, the senator said, that's a great idea, Mr. Rogers, but how do we boil the ocean? Well, I'm an idea man. You're going to have to ask the engineers about that. I just want to talk about some of the basic ideas. One of the ideas that is underlying one of the biggest problems in healthcare is the idea of profit. When health insurance first started, it was during the Depression of the 1930s, and hospitals and medical providers weren't getting paid because nobody had any money. So they started what was known as Blue Cross and Blue Shield, and they asked employers to provide this coverage for their workers so that the hospitals wouldn't be going bankrupt and that the physicians would be able to afford to treat the patients. But they were set up as non-profit organizations. Well, somehow or other, things evolved, and somebody had the bright idea that the best way to control healthcare costs was to open it up to the open market. This is kind of a libertarian idea. A lot of libertarian ideas sound great, but when you stop to think about them, then it gets a little bit more complicated. And what we've done is we have complicated our healthcare situation so that at least a quarter of all our healthcare dollars are going to the insurance industry. WellPoint showed a profit, or rather costs, in their Securities and Exchange Commission report. They took 15% for profit and another 15% for administrative costs. Administrative costs, that means the money that they pay the lobbyists in Washington to legally bribe our elected representatives. I didn't think of that. I heard it on public radio.
Okay.
But what we've come down to is that a large part of our healthcare dollar is being taken out of the healthcare system. This is money that should be paying for medical education, medical research, patient care. But according to the president of the American Medical Association just a few months ago, he said, in the present political environment, the single-payer option, where the government would pay all healthcare expenses, is just not possible. And that's probably, I'm sure, it's probably true. But we have to think about what we want to have as a healthcare system. Do we want people who are not contributing anything to our healthcare walking away with millions of dollars in bonuses, which is the situation that we have seen? The insurance companies are not solely by themselves the reason that healthcare is so expensive in the United States. We have the most expensive healthcare system in the world, and the insurance companies are making their contribution to that cost, even though there are many, many other problems and situations that have to be addressed in order to bring down the costs. Anyhow, we cannot at this time expect to see a single-payer insurance, a single-payer healthcare system come into existence. But what we can do is start to make inroads into the concept that competition in an open market is the cure for our healthcare problems. There's an economic concept known as elasticity, which says that as demand increases, the price goes up. When demand drops, the price goes down, and that these two factors are related, as well as supply and demand. But in healthcare, there's very little elasticity. If you have a child with leukemia, you're not going to shop around for the cheapest oncologist. If you have a medical emergency, you're not going to look for the cheapest emergency room. Medical care is not elastic at all. Healthcare is not elastic at all. So the idea that it responds to free market forces is mistaken. At least in my opinion, it's mistaken. And until we get over that idea, we're not going to have a lot of success in reforming our healthcare system. I think I've pretty much said everything I need to at this point.
Thank you, Dr. Smith.